This is Nadir Shah in Chicago, and you're watching my channel Knowledge for Quality of Life. I welcome all those who recently joined the channel and this community of learners. Uh, I welcome you all, and I request you to periodically check all my vlogs, take your time and watch it, comment it, uh, whatever the concerns you have, and if I can, then I'll be able to, give you the responses accordingly. Today, I wanted to talk to about a topic. It's very dear and near to me also, because I have a family member who has a ApoE34, one genetic variant, which is ApoE4, which is called for dementia risk gene. And you can have a one copy of four or double copy of four, and risk varies. Now, this coming week, May 20th and 21st, in Washington, D.C., they have announced that, there is a advocacy days for dementia and Alzheimer's, and the next entire week is going to be an action week for dementia and Alzheimer's. I have received something very crucial output of data, very extensive data throughout the world, and I'm going to share a snippet of that data in a minute. Before I do that, I'm going to include that link in my description so you can take time to read it very carefully and digest it over time, because this is very important. This is just like a 2025 most recent data, and it's eye-opening. Every 3 seconds, somebody develops dementia in the world. This is the data. And, according to the experts, after observance of these data, they have declared that 80% of the dementia and Alzheimer's disease can be prevented, uh, provided we focus on these factors. So these factors are given by these experts around the globe. So let me share my screen. So what you see here is modifiable risk factors. So let me explain you a little bit, the legends here, so that you can follow the pictorial representation of this data, the output. So you see here that Alzheimer's modifiable risk factor estimated impact. After looking at the humongous amount of data throughout the world, including China, U.S., Canada, Holland, you name it, very a lot of places in Europe, as well as in Asia and everything. So you see this legend here, the colorful legend. If you see any green here markings with the green color, means they are saying that we need to improve in that area. Red is to reduce or avoid, and yellow is a legend to correct. Means, of course, you cannot reduce or you cannot avoid. You need to correct. So as we go on, we're going to see this, what that means. What with parameters they're talking about to correct. The first column here is the prevalence, is the percentage of people who have this risk factor. Okay, so this first column, you see that uh, percentage of people who have this risk factor amongst the data they have observed. They have crunched that data. The second column here, you see population attribute risk, PAR, is how much this contributes to overall risk. So if you see here that 13% here, this contributes to the overall risk of Alzheimer's or dementia. Okay, so this is what population attribute risk means. The third column here, it says positive action, what we need to do, what actions they are guiding us to take to correct this issue. The last column here you see is impact on us, the percentage risk reduction. So is the percentage risk reduction you would be likely to achieve if you had this risk, if you have this and corrected it with the positive action. So if you take the positive action of this risk factor, which one has, then you will reap the reward in terms of percentage reduction in dementia and Alzheimer's overall. So if you look at the first one, the prevalence risk is 33% and homocysteine. Last my vlog was about homocysteine. You remember that most of the variables you will see here, I have covered vlogs on individual separately. So please, I have a request, watch those, how to mitigate, how I did it, because this is all my practices. Whatever I'm telling you, whatever I'm sharing here, we are following to the T's, at our home. So homocysteine, high homocysteine means greater than 11 nanomoles per liter. Last vlog, you remember that, percentage risk contribution towards dementia or Alzheimer's is 13%. That's the highest. So homocysteine plays a vital role. Now, remember that, drug companies are working on, making the drug for dementia and Alzheimer's, but, the results are not very optimistic because, the amyloid beta plaque, which builds up in the brain, they are trying to eliminate that with the drug, but, there are horrendous side effects like bleeding and all that. So, if the experts are saying that 80% of the risk of dementia and Alzheimer's can be mitigated through this alternative lifestyle and through these parameters, then why not? Okay. So first is, we talked about homocysteine. Second is low omega-3 index, which I mentioned also in my separate vlog and last week as well, that, if someone's omega-3 index is less than 5%, average American has about 2.5 to 3%, and Japanese has about 11 to 12%. So the omega-3, because remember that brain is nothing but it's a blob of fat. So your brain needs to thrive on fat, and omega-3 fatty acids is the best way to go, not only for brain, for heart, and overall your quality of life. What you need to do here in the first homocysteine, that you have to lower your homocysteine by adding your B vitamins in your diet. And the target is, you have to bring your homocysteine below 10 nanomoles per micromoles per liter. And that will give you a 40% reduction in the risk factor of dementia and Alzheimer's. That's the highest if you look at all the parameters here. The omega-3, you have to take, as I said in my last vlog, that omega-3 has to be in the range of 8 to 12%. Minimum is 8%. And how you do it? By checking your blood work. You need to see what the omega-3 number is in your blood serum level. And that's going to give you a 20% reduction. Now, this green is that, you have to improve. All right. Improve means you have to increase omega-3, and here you have to reduce homocysteine. So here, that's why it corresponds to red, to reduce or avoid. Okay, I'm going side by side so that people can follow that what these color coding means and what the percentages means. The third number is that prevalence is 50%, low fruit and veggies, and vitamin E. That's a 10%. Okay, that's a 10% risk. So it's a second highest. Now optimize antioxidants, veggies through fruits and veggies and vitamin C. That's going to give you 20% risk reduction. So you have to increase your veggies in your diet. And remember that the veggies, the type of veggies you should eat, it's very low cooked, stir fry maybe. If you want to see my vlog that what veggies we use and how we make it, I have covered in the separate vlog. So it gives you all the complex carbohydrates which one would need, along with the minerals and vitamins, along with the antioxidants. And fruits, you have to be mindful that it should be low glycemic load fruits, so that you don't creep up in the insulin resistance. and vitamin C. And that's going to give you a 20% reduction. Now, 40% prevalence is high carbohydrates diet, which is refined flour, grains, and sugars, all sugars. The risk factor is if your HbA1c is greater than 6%. And now, insulin resistance factor, I have covered in separate vlog that you have to see your HOMA-IR, make sure that, that gives you a better picture than HbA1c or fasting blood sugar. Calculate your HOMA-IR. Get your fasting insulin done. Multiply that fasting insulin by fasting blood sugar and divide by 405. If you are in the United States. If you are in the metric system, then international units is you have to divide by 22.5. So get your IR number, insulin resistance factor number, to make sure that what your homeostatic model and assessment is telling you. Now, how you do it? Eat low carb diet. Okay. Low glycemic load fruits. Prevent diabetes means you have to make sure that you are not creeping towards insulin resistance, because that's the starting point. And again, I have covered in metabolic syndrome as well, because first stage is metabolic syndrome, and then eventually you go creep towards insulin resistance, and then once you go out of the range in insulin resistance number, then one would become a diabetic. The next one is 28% prevalence, physical inactivity. I have covered this as a separate vlog as well. So you have to be active mind, active body, 22% reduction. So if your physical activity is not there, increase it. That's why it's green. The next one is excess alcohol. Alcoholic consumption that is, greater than 14 units. That's a 5%, your risk factor towards dementia or Alzheimer's. Because you remember that what alcohol does, it increases your insulin resistance, slowly and gradually. And no matter, no doubt about it that it impacts your other organs as well, but, it takes you towards insulin resistance. Minimize alcohol or avoid it. I've never, as I said in the past, that, I've never tasted, nor I have a desire of tasting one. And that is going to give you a 20% reduction. Low vitamin D. I've done enough vlogs, and hopefully in future I will be doing more as well as the new research is coming out more and more. So low vitamin D, less than 50 nanomoles per liter. Now, this is in nanomoles per liter, but that if you divide that by 2.5, that's going to give you a 20. So anybody in the United States or where they use the unit of nanograms per milliliter, 20 or below is a risk factor, of 5%. Increase your vitamin D with sun exposure or with the supplement, at least minimum 75 nanomoles per liter. And that's a 20% reduction in your overall risk for dementia. The next is 49% prevalence. Low consumption of eggs, and low consumption of choline. Choline is a mineral which we need, which our brain needs, which our heart needs. It's a fantastic, stuff that you can have for your brain and heart both. Low eggs and choline contributes to risk factor 5%. Eating eggs, seafood for choline greater than 400 milligrams. And that's going to give you a 10% reduction. Bad sleep. We talked about it in the past, sleeping patterns, right? 6 to 7 hours of sleep. Anything less than 7 hours, it gives you a 5%, risk towards dementia. Good sleep, at least minimum 7 hours or more. And that's going to give you a 30% reduction. So, avoid sleeping less than 6 to 7 hours, because it does tremendous damages to our not only our body, but, including brain as well. Antacids. The next one is 30% prevalence. Antacids. People use antacids for GERD, acid reflux, and, left and right here. We just pop the pill just like we are eating chocolate. That's a 5% risk factor. Not an antacid or metformin. So try to avoid it. If somebody is eating late, just have 3 to 4 hours of your final meal of the day before you hit the bed. Keep that gap, and that's going to give you a 15% reduction. Hearing loss. So hearing loss is, if hearing loss is there, which remains untreated, that contributes to 4% risk. And it's a requirement. If you're not hearing properly, then get a hearing aid. Use it. Some people get it, but for whatever reason they don't want to use it. For it doesn't look good or whatever. But make sure that this area is addressed as well. That is going to give you a 14% reduction in dementia. So if you add these all numbers, the cumulative impact is going to be huge, and that's what the expert says, that, you can have an 80% reduction overall. So having a gene of ApoE4, one copy, which gives you a genetic risk of 30% having a dementia or Alzheimer's in the later part of your life. And if you have a double copy, you can have that probability increased to 90%. But remember that, again, for one copy of 4, the 70% don't get it. It means that they are controlling, and these factors are under our control. It's not genetic. It's in our hand. We control these numbers. We can completely reverse. Choice is ours. That's the bottom line I'm trying to say. Choice is ours. So high stress and depression, 40%, 4% risk. And that's 20% prevalence. Low stress environment. Deal with the stress. Stress is good, as I said. But you need to know how to manage the stress, because there are some things which which creates an opportunity when you are under stress. But don't take that stress to overrule you, rather than you manage that stress very well to get the desired outcome. So low stress environment, mitigate that stress, and 22% reduction in the overall risk. Poor gut health, poor microbiome is 3% risk and 15% prevalence. Healthy gut, so eat variety of probiotics, particularly homemade, just like we use, yogurt, natto, whatever you can, some people prefer to make kefir. Use that, in whatever form you want to have a good microbiome. It's going to help you in 25% reduction towards the dementia. Inactive mind or less social, right? So that is 15% prevalence and 3% risk factor. Active mind, not retiring early. Okay, so keep your mind preoccupied. They say that, not routine things which you are doing. Do something where your brain is being stretched as far as thinking is concerned. The more you use your brain, the better you will get that synapse connection, neurons to neurons. Because, the rule is like, use it or lose it. So if your brain is active, then probably you're going to have a better, risk factor, for the prevention, from prevention point of view, for dementia and Alzheimer's. And this tells us here that 22% reduction here. Overweight, low muscle mass. Overweight means obese, higher BMI. That is one of the factor of metabolic syndrome, and you are inching indirectly towards insulin resistance. And eventually, if you are not careful enough, then probably pre-diabetes or diabetes. Then overweight, that positive action, what you need to do, try to bring yourself to the natural weight, because every one of us has given a natural weight. Either we go under due to malnutrition, or we go over by taking more calories and inappropriate calories, inappropriate diet than what our system is designed for. So that's going to give us 20% reduction. Air pollution. Air pollution, we don't control that much, unfortunately, but it's 50% prevalence, 3% risk, and minimize air pollution. And that's going to give you a 6% reduction. Now, when we are in home or when we are in car, make sure your cabin filters are replaced in a timely manner, because you're sitting inside. The heat or HVAC, the cool air is coming through that cabin filter. If that is junky filter, some people I know, they never check their filters, and they don't even know that it's there, right? So if you're not going to change it, all these polluted filter, which is air is coming through the polluted filter or dirty filter, you are inhaling inside the car. Same thing goes inside your house, where you are using the HVAC system, either in the winter, when your heat is working, or in summer when your cooling is working, air conditioning is working. Make sure that your filter is changed and you are using the high MERV filter. Of course, when you are going outside, you don't have that much control. Smoking is 10% prevalence, 2% risk. Don't smoke. Of course, it's not from dementia or Alzheimer's perspective, but from the cancer perspective, for stress perspective, smoking is not good from any angle. That's going to give you a 15% reduction in overall risk. Visual loss, we talked about it, in taking care of one's eye, untreated, particularly macular degeneration, glaucoma. These are very silent killer. There is no sign. So I have covered that in a separate vlog as well. Good vision, 20% reduction. Then the last one, but not least, menopausal. No natural hormone therapy replacement. That's a 2% risk, 20% prevalence. The positive action is let it be natural menopause. Impact on the reduction factor for dementia or Alzheimer's is 10%. Let me stop share here. This is very powerful. If the scientists, the research folks who put together, crunch together all these data, millions of people, they came up with these parameters, which I just shared with you. And if you notice that, date is 2025, so it's pretty recent. And I'm going to share the details of that article under the description. So take your time, read it, because remember that, sometimes I have seen, because I'm part of the two forums, on coronary artery disease and osteoporosis as well. Some people are so bogged down in one cause mortality, either heart disease, or some people are osteoporosis, or some people are drawn to completely, one area. But, we have to think in a bigger picture that, we do certain things, what our body needs accordingly, so we can have a better image, better picture of overall low-cause mortality, not only low-cause mortality, but also from quality of life, health span. Remember that I've been saying this thing, that we are not talking about longevity here. We are not by any means immortal. We all have to go one day. But whatever the time frame we have, we want to live a quality of life. That's what we are striving for. Because no matter how healthy I am, no matter how careful I am in my eating and lifestyle, what if I hop in the car and somebody hits me and I'm done, right? That's beyond my control. That's not in my destiny. That's not what I control. That's the parameter. That destiny is beyond my reach. I cannot mitigate that thing, right? So whatever God has given us intellect to think about it, act upon it, with the rationale and with the logic, I think we should do it by all means. This is the message I want to leave you with. Hopefully, see you next week.